complication screening. When should we doing this, and why should we do it, and in whom should we do it? Hi, I'm Dr. Lakshmi Nagendra, endocrinologist at Magna Centers, Mysuru. And when we speak about diabetes complications, I see that many patients are not aware why exactly are we doing it. So many patients tell me, Doctor, I don't have any problems with my eyesight. Why should I screen for retinopathy? Doctor, I don't have any problems with my heart. I don't have any pain, or I don't have any breathlessness. Why should I do an ECG? So it's very important to know that there can be complications in diabetes without actually having symptoms. For example, you could have a diabetic retinopathy is something that affects the nerves in your eyes, even without you knowing it. So in the early stages, you might even not know that you have diabetic retinopathy, and only in the later stages when it affects your vision, it may be too late to bring about an effective treatment. So the best strategy to prevent diabetes complications is to screen for them every year. So the minute you start to develop some of these complications, you can actually stop them at a very early stage so that you don't go on to have these complications. For example, we screen for something known as diabetic nephropathy, so diabetic kidney disease. So as you know, uncontrolled diabetes can affect the kidneys, and having a diabetic kidney disease can actually lead to kidney failure, dialysis, renal transplant, so on and so forth. But actually, can you screen this for diabetic kidney disease and prevent all these complications? Definitely. We do something known as urine microalbumin screening. So we look for the excretion of protein in your urine at a very early stage, and this actually precedes the rising up of creatinine. So all of you might be aware that we do a blood test known as urea creatinine to look if the kidneys are actually affected in diabetes. But even if before the creatinine goes up, even before the creatinine can be affected, we can screen this by something known as urine albumin creatinine ratio. So we look for the excretion of protein in your urine, and then we know that the kidneys are starting to get affected, and immediately we have effective treatments which can stop this. And of course, the cornerstone to prevent all of these complications is good diabetic management. So if you have well-controlled diabetes, you are unlikely to develop these complications. So you should be optimizing your sugar control, and after that you should be screening for these complications at least once a year so that we catch them at an early stage and you don't go on to have severe complications. So we should be screening for something known as microvascular complications and macrovascular complications. So microvascular complications, we would be looking for neuropathy, nephropathy and retinopathy. Retinopathy is screening your eyes, something known as fundoscopy, to see that if your eyes are affected, we can actually treat them at a very early stage by something known as laser, or even injections are available so that you don't go on to have blindness. Nephropathy I actually discussed. So we screen the excretion of protein in the urine, something known as urine albumin creatinine ratio or urine microalbuminuria, to see that if your kidneys are affected, and if they are affected, we start the therapy at that stage itself so that it does not progress to kidney failure, or you don't have to go for an end-stage diabetic kidney disease or require a transplantation. There is also something known as screening for diabetic neuropathy. So we screen to see if your nerves are affected, and also we also have macrovascular screening in diabetes. So here we screen for peripheral arterial disease. So if we do something known as ankle brachial index to see if your arteries are affected by diabetes, and if they are affected, that can be treated as well. Apart from screening for this, we also do a ECG every year to see if your heart is affected, and we can catch this at an early stage. Further screening, cardiac screening will depend on the symptoms that you have. So it's very important to do this screening at least once a year to see that you have not developed any of these complications, and even if you have, they should be treated at an early stage so that you don't go on to develop the end stage of these complications, which can cause a lot of morbidity.